Malaria is a life-threatening disease of the 20th century. People affected by malaria usually experience high fever. This disease is caused by the bite of an infected parasite, a female anopheles mosquito. A report by the World Health Organization reveals that about 247 million cases of malaria were recorded in 2021, risking about half of the world's population at risk of getting this disease. The most affected country by malaria is Africa, which is also called the home of malaria infection. People of any age or any gender are equally at risk of getting this fatal disease. Malaria transmission occurs when an infected anopheles mosquito bites a healthy human. During biting, a mosquito transmits a malarial parasite, usually the parasite species belonging to the Plasmodium genus, to the healthy individual's bloodstream. The worst stage of malaria leads to anemia or jaundice and even organ failure, which leads to death. The root of the malarial parasite was first discovered in humans around 25 to 30 million years ago. This disease is now preventable and curable. WHO recommends a malarial vaccine and some preventive medicine to avoid this disease, especially in tropical regions. If you ever experience malaria, stay connected with us. We are going to explore malaria's history, its transformation, and ultimately, the treatment of this disease. What is malaria? Malaria is a severe disease that sometimes may become fatal. Parasites that live in mosquitoes and feed on people are thought to be the main cause of this illness. People who have this disease get chills, fever, and flu-like symptoms. It has symptoms similar to flu, but you cannot catch it from other people because it cannot spread by air. Besides that, this disease cannot be spread through sexual contact. The World Health Organization said that 247 million people got sick and 691,000 died around the world in 2021. America, Southeast Asia, the Eastern Mediterranean, and the Western Pacific were the places where most of these deaths were reported. Between 95% and 96% of malaria cases and deaths are said to happen in Africa. Around 80% of children younger than 5 years old who lived in this area died from malaria. This disease is most likely to spread to babies, young children, pregnant women, older people, and travelers. History of malaria. Malaria disease history in humans dates back to ancient times when the Chinese and Egyptians initially considered it a mysterious illness that causes fever. But wait here. This was unknown until the late 19th century. A parasite responsible for malaria was found in the 1880 E. A famous fresh surgeon, Charles Lewis, who identified this parasite, named it Plasmodium. This surgeon assumed that Plasmodium survives in the blood of its host. Currently, it is worldwide well familiar that Plasmodium is the cause of malaria. The transmission of malaria was identified later in another research conducted by two scientists named Ross and Grassi. Causes of malaria. The leading cause of malaria disease is a parasite that causes its transmission. There are about 5 malarial parasite species responsible for malaria, of which Plasmodium vivax and Plasmodium falciparum are more threatening than others. Other causes of this disease include blood transfusion, organ transplantation, pregnant woman to an unborn child, and use of an infected needle. Malaria transmission cycle. Malaria transmission occurs in a cycle in which a mosquito becomes infected after biting a malarial patient, then the same mosquito bites a non-malarial person, transferring the parasite from the infected person to the non-infected person, resulting in malaria in the healthy person. Only female anopheles mosquitoes can transmit malaria from one person to another. Let's examine the whole transmission cycle of this disease. The first mode of transmission or spreading of malaria is a parasite known as female anopheles mosquito. A mosquito bites a person who has malaria. If the same mosquito bites you, it will transfer the malarial parasite to your body. That parasite travels in your body and transfers to the liver, where it matures and starts infecting your red blood cells. At this stage, the patient experiences the symptoms of malaria disease. Signs and symptoms. Malarial patients usually experience symptoms such as severe fever, with sweating, headache, flu, nausea, fatigue, chest pain, cough, vomiting, and muscle aches. It may cause anemia and jaundice, in which red blood cells are lost, and, if not treated on time, can lead to kidney failure, mental confusion, coma, and even death. These signs and symptoms may be evaluated within a week after the biting of an infected mosquito, and in some cases, patients could feel these symptoms after a year. Complications and symptoms. The Plasmodium species present in Africa can cause more deaths than other species. Among Plasmodium species, Plasmodium falciparum is the most common cause of malaria in Africa, and this species is responsible for severe cases of malaria, which is why malaria infection in Africa is more deadly than that found in other areas of the world. The Plasmodium falciparum leads to the deaths of patients who exhibit the following complications: cerebral malaria, a condition in which the malarial parasite blocks the blood vessels of a patient's brain, which leads to the swelling of veins. It causes seizures and coma. Pulmonary edema. It is a condition or stage of malaria in which the lungs of patients are accumulated by fluid and cause difficulty breathing. Organ failure. A malarial parasite that enters the body of the patient may damage the kidneys, liver, or spleen. Any of them would lead to death. Anemia. A condition in which a patient's red blood cells decrease enough that insufficient oxygen runs into the patient's blood. Low blood sugar. Severe malaria can cause hypoglycemia. It usually happens due to the medication for malaria. Very low blood sugar can even lead to coma or death. Diagnosis. A patient who experiences malarial patient symptoms is diagnosed by examining his medical history, travel history, physical examination, and blood tests. Traveling history is essential because if a person has recently visited any country with high malaria cases, this person may get malaria from that country. After getting this information, the physician will take a blood sample and examine the patient's blood report. If the blood contains a malarial parasite, doctors examine which species it is. The doctor also examines whether this parasite causes any serious complications or not. Sometimes, doctors recommend a test that gives results within 15 minutes, and sometimes they come in weeks, depending on the symptoms or complications a patient exhibits. Treatment. An essential thing after malaria diagnosis is to start its treatment as soon as possible. The doctor will recommend some medicines that kill malarial parasites, but in some cases, these parasites are resistant to malarial drugs. Therefore, medication for this disease depends upon the species of malarial parasite present in a patient's blood. Additionally, different drugs are prescribed to avoid resistance, including atovaquone, mefloquine, chloroquine, quinine, and primaquine. Artemisinin is another antimalarial drug which is commonly prescribed to treat malaria disease caused by Plasmodium falciparum. Generally, antimalarial medicines can show some side effects, including headaches, gastrointestinal issues, insomnia, seizures, and anemia. Therefore, always be careful while taking these medications. It is critical to discuss with your doctor if you have any side effects after taking malaria medicine. Prevention. If someone has to travel to a country where cases of malaria are high, they should talk to their doctor to take some medicines. While staying there, use mosquito anti-repellents, drape mosquito netting, close windows and doors, and wear long pants and sleeves to ensure maximum covering of your body parts. People, especially children, can take a vaccine for malaria that is tested in Ghana, Kenya, and Malawi, and this is effective against Plasmodium falciparum, which causes swerve disease in children. Recently, researchers achieved significant advancements in developing effective anti-malarial drugs, insecticide-treated nets, and indoor residual sprays to compete against malaria. However, malaria is still a major global health challenge, especially in tropical regions. Efforts are still in progress to find new strategies to prevent, treat, and even eradicate this disease. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.